Good morning. This is Dr. Timothy Scott Beck here at LifePoint Medical. It is September the 2nd of 2021, and I want to say good morning to you and remind you that we're here for you if you need something. Let's talk about COVID-19. It is rampant now in the community and throughout the state. It does look like it's the variant, and I know I talk about this every day, but just to remind you that it's out here, and the Department of Health stuff is just the whole state is deep red. Like there's a lot of cases go around, and we've seen people suffering from it this week. And I'm getting questions daily about the vaccine, and I just want to remind everybody that's a individualized conversation. I've made lots of general statements about it, about who I think should get it, and I'm giving people advice. But if you want me to tell you exactly what I feel, just make an appointment and I'll tell you, and I'll talk to you about it, and I'll give you both sides of the good and the bad. Okay, and I've built up quite a bit of things because I can talk about both sides. But I want to reiterate one thing, and this is the one thing that I have, because I'm about life and death. Okay, well, I'm about life, not and preventing death. To a reasonable degree of medical certainty, I can tell you that the vaccine will mediate your risk of death. I can't tell you anything about the vaccine, its long-term effects and stuff like that. I'm pretty confident in it, in the sense that I don't think it's going to be there's going to be a lot of negative effects to it for most people, and there is some people where I'll tell them don't get the vaccine. I don't think it's good for you, but that's a very few people. So let's keep it private and personal. If you want to talk to me about it, please make an appointment and we'll discuss it with you, and I'll give you my best answer. We had 1,763 cases here. That's up 3 from yesterday, and I'll tell you that is very, very, very small compared to what's really happening. So keep wearing your mask, keep using hand sanitizer, keep social distancing, and we've got our system around here really good. I think if you think you've got COVID, we've got everything. We've treated at least 20 or 30 people this week using our system of the videos and the outdoor testing and all that stuff, and we want to help you with it. We want to provide you with the treatment protocols that we've been put up. Some people don't want them. If you'll let us know if you refuse them or don't think you need them. However, otherwise I will write for you, and I've got the pharmacies. They are giving me the ivermectin, and without any trouble. It's just the large doses of ivermectin I'm not going to be giving. Okay, and I had to draw the line there. So please keep us in mind. If you have any medical issues, and I want to actually focus in on that a lot, a little bit. So when you come to see me, I get different flavors of people that come in here. Some people come in and they tell me what I'm going to do and how I'm going to do it, and a lot of times I don't argue with them too much, particularly if it's legitimate and I agree with the premise of what they're acting on. But sometimes I think people get themselves in trouble because they tell me to do something and I'm like, well, I haven't had a good experience with X, Y, and Z, so you might not want to do that, but they don't want to listen, or they're already set, or they listen to somebody else tell them what to do. The cool thing about where we're at in this office is we are getting constant feedback from patients and other doctors and outcomes of surgery and different things, to where we get a pretty good idea in this area about who does good work and who doesn't. And I have a referral base that I've been using now for years. Some of them are good, some of them are bad, some I have no choice. Okay, they're the only person there or something like that. But the thing about it is, for most services, I can find a really good provider for you, or somebody who I've had a lot of positive about. Okay, so I guess the thing is, when you have a specific medical problem, and it can be any medical problem. Okay, I'm an internist, so we recognize every single medical problem you have. It's just we don't take care of all of them, but we can get you somewhere too, or we can determine who's the best person for you to be seen. Okay, so just like if you come in with a you know, a really bad hand injury. Okay, I know where to send you to. I know a guy who does a really good job with hands, and I can get you in there and get you seen. And I have feedback from patients says he really does a good job. And that's what I want to reiterate to you. If you've got a medical problem, and even if you got your ideas about what you want and where you want it to do, ask us. Say, hey, I've got this medical problem. What would you do in this situation? And let me tell you what I would do. And then maybe you compare that to what you were planning on doing. And you might find out that might be a better way to do. The only other thing about it is I have a little bit of accountability with some of these people. And I don't think, most of the people I use don't need a lot of me holding them accountable. They do a good job. And they know it and I know it, and we all work together, and that's a wonderful relationship to be in. So there is a little bit of that. I mean, again, most of the people I do, they don't have to do a lot of extra stuff. They treat people good anyway. But I just want to tell you that ask me what I would do in those situations. Where would you go? What would you do? And I'm always going to give you my best answer. And, mine and all, A, what's wrong with you? Number two, the complexity of the situation, what your insurance does and what they don't, and all that other stuff. So anyway, that's my advice. Everybody have a wonderful day. Give me a call if you need something. Thank you.